Difference between HDL and LDL cholesterol. Along with smoking and high blood pressure, raised blood cholesterol is one of the main risk factors for heart disease. People can reduce their blood cholesterol with a healthful diet, exercise, and medication. The two main types of cholesterol are high density lipoprotein HDL or good cholesterol and low density lipoprotein LDL or bad cholesterol. Some cholesterol is needed in the body, but high levels can be dangerous. In this video, we look at HDL and LDL in detail, including what makes one good and the other bad, as well as what a person can do to keep levels in check. HDL versus LDL cholesterol. LDL cholesterol is often called bad cholesterol. If there is too much LDL cholesterol in the blood, it builds up in the walls of the blood vessels, causing them to narrow and stiffen. A buildup of LDL cholesterol reduces blood flow and can increase the risk of heart attack or stroke. HDL or good cholesterol can move LDL cholesterol from the blood to the liver to be broken down and disposed of as waste. HDL cholesterol is referred to as good cholesterol because it reduces the level of cholesterol in the blood. Higher HDL levels are linked to a reduced risk of heart attack and heart disease. What are the ideal ranges? In the United States, cholesterol is measured in milligrams per deciliter. The guidelines for healthy cholesterol levels are as follows: total cholesterol below 200 milligrams per deciliter, LDL cholesterol less than 100 milligrams per deciliter, HDL cholesterol above 40 milligrams per deciliter. Different regions and countries may have varying guidelines, so it is wise to speak to a doctor about the most accurate and up-to-date ranges. Causes of high LDL cholesterol. Eating a diet high in saturated fat. Diets high in saturated and hydrogenated fats can increase LDL cholesterol levels. Inactivity. Not getting enough exercise can lead to weight gain, which is linked to increased cholesterol levels. Obesity. People who are overweight have an increased risk of high cholesterol levels. Smoking. A chemical in cigarettes lowers HDL cholesterol levels and damages the lining of blood vessels, which can increase the risk of hardening of the arteries. Medical conditions. Some of these that can affect LDL cholesterol levels include type 2 diabetes, underactive thyroid, kidney or liver conditions, and alcohol addiction. Menopause. For some women, cholesterol levels can rise after menopause. Genetics. Familial hypercholesterolemia or FH is an inherited form of high cholesterol that puts people at risk of early heart disease. How to reduce LDL levels? The following lifestyle changes can help lower LDL cholesterol: maintaining a healthy weight, exercising regularly, quitting smoking, using statin therapy when prescribed, taking niacin vitamin B3 supplement. Some studies have shown vitamin B3 can lower LDL cholesterol while raising HDL. It is important to talk to a doctor before taking niacin supplements. People trying to lower their LDL cholesterol should also avoid eating saturated and trans fats. Foods to avoid are cakes, cookies, and pastries, frozen ready meals such as frozen pizza, margarine, fried fast foods, cream-filled candies, donuts, ice cream, packaged puddings, pre-made breakfast sandwiches, potato chips. How to increase HDL levels? A variety of things can improve HDL cholesterol levels include omega-3 fatty acids. Omega-3 fatty acids can lower blood cholesterol when consumed as part of a balanced diet. The highest levels of omega-3 fatty acids are in oily fish such as mackerel, trout, herring, sardines, fresh tuna, salmon, and halibut. Studies suggest eating 2 to 3 portions of oily fish each week can increase HDL levels in the blood. Brightly colored fruit and vegetables. The antioxidants in brightly colored fruit and vegetables have been shown to improve HDL cholesterol levels. Regular exercise. Research shows that exercise and physical activity can raise HDL levels. High LDL cholesterol is a risk factor for heart disease, but it can often occur without any symptoms. It is recommended that people over 40 years of age arrange blood tests to check their cholesterol levels and total cholesterol to HDL ratio. Dietary and lifestyle changes can make a big difference to HDL and LDL levels. If they do not improve with these changes, a doctor may recommend medications.